The moderator for today's presentation is George Danusis.
Good day. Today our topic is going to be healthcare in America. And I have a special guest with me, and that's our intern from Bloomington University, Courtney Seward. And Courtney has been helping us analyze healthcare in America and how to reduce costs. So Courtney, what statistics have you uncovered in your short visit here?
Well, currently a third of children are obese. The statistic is not changing. It keeps on increasing. $3 trillion is spent on healthcare in America. This is currently 1/6 of the GDP. If wellness is implemented, this can save $1.5 trillion.
An interesting thing also is that these statistics are not changing. That's the scary part. We still have approximately 20% of our population still smoking, even with all the warning labels on cigarette packs and people understanding what future health crisis can happen from that. There's another thing that we've been analyzing this summer, and that is the concept of high-risk and low-risk types of individuals. And we were very fortunate to share information with Dr. Eddington from the University of Michigan, an authority in this field. He's been studying healthcare and the usage of healthcare in America for over 30 years from that campus. What did you find out from him?
Well, Dr. Eddington cites two different types of individuals, high versus low type individuals. High-risk individuals represent 14% of the population, and low-risk individuals represent 86% of the population. However, high-risk individuals in a 55 to 60-year-old bracket age range spend over $580 more on healthcare per month than a low-risk individual in that age bracket.
It's a shocking statistic to think that a very small percentage of our population is accountable for probably 80 to 85% of all healthcare. Something has to change in that system. So, speaking of having to change that system, we've been discussing ways of changing that. One of them, of course, is in our educational system. It is time for us as a society to implement programs that will teach children how to eat better, exercise better, and eliminate stress in the future. That is a good long-term program. It takes a lot of time to get that type of legislation and curriculum put into the school level. So what we've been concentrating on, and Courtney's been working on exclusively, is how to educate at the work site. So what kind of programs have we implemented?
Well, we've implemented a web-based wellness program, which allows employers to get their employees on a wellness program that can work on their fitness levels, nutritional level, and their sense of well-being.
And the shocking thing is, for every dollar spent in wellness today, there's a return of about $7 to employers. Another interesting thing for Indiana residents is the state of Indiana now gives tax credits to employers that implement these types of programs, and that tax credit is 50% of the cost of the wellness program. So there are many incentives here. The greatest incentive, of course, is we will reduce healthcare costs. When we reduce healthcare costs, we're able to take those monies and put them into other directions, things like savings, future retirement, college education payments for children. It's just a better place to spend our money. The other reason is, at the pace America is going, we will not be able to compete internationally, we won't even be able to walk. Enjoy your day. Thank you for joining us.
To contact George Danusis with any questions you might have, here's a copy of his contact information.